Thank you very much, Dr. Yashwant Patil, for those wonderful words and for your assurance of being with us during our programs in future too. It is now my pleasure to welcome Mr. Bernard Kadasia, the President of the Alliance for Health Promotion, Geneva. Alliance for Health Promotion is an official relations with the World Health Organization and the ECOSOC. Its mission is to support individuals and communities to take control of their own health and well-being. He is also president of the North Star Alliance, an NGO registered in Netherlands. Its mission is to provide quality healthcare services to mobile populations and the communities they interact with. A member of the board of GENDRO, an international NGO whose mission is to advance equity through the integration of sex and gender dimensions in research. Over to you, Bernard, for your views.
Can you hear me?
Yes, sir, we can hear you.
Thank you, Elizabeth. And let me start by congratulating Rotary Bangalore Abilities, FKCCI, HDBF, and ComHard, and also to say it's a real pleasure for me to join you, this being the second time that I'm participating in an event like this one. Let me begin by saying that the Alliance for Health Promotion advocates for a positive view and vision of health, which integrates physical, mental, spiritual, and social well-being. Now, we must remember that it is often quite easy to think about health in terms of diseases, but the Health Promotion Alliance goes beyond that and would like us to go beyond that. The focus of the Alliance is on empowerment, inclusivity, equity, and meaningful participation within a human rights framework. The Alliance has been very deliberate and determined in its efforts to see that health and well-being are addressed at the point of the determinants of health, and not at the time when people are suffering from ill health. What are the determinants? Economic factors influence the health and well-being of people. Also, social factors, racism, caste systems, poverty, or inequality also affect the health of people and their well-being. Political, policy making and political decision making, distribution of power, all this affect the health and well-being of people. And more recently, we are all aware about environmental factors, including pollution and climate change, that are really affecting the health and well-being of people. Again, as the world continues to innovate, as my previous speaker mentioned, you have also technological determinants of health, especially in this digital world. And now there's a growing ill health that emerges from digitalization. And then for a long time also, we have had problems to do with commercialization, meaning the commercial determinants of health, including tobacco use, but also even the way, for example, vehicles are designed or transport is designed is to make money rather than to really serve the people. So addressing, if I come to the topic today, addressing accessibility for persons who are differently enabled or able enhances inclusivity. It also contributes to social justice and to the promotion of health equity. Absent, inappropriate, or inadequate accessibility means that those who are differently abled will be excluded from economic and social participation. People who are differently abled need to be able to go to places of work or places of industry. Now, if they don't get there, or if they get there with extreme difficulty, this is a form of exclusion, which first and foremost impacts upon them, but also impacts on the society as a whole. If children who are differently abled cannot go to school or go to playgrounds but cannot participate, they are excluded. Well, quite generally, we now all have talked about universal design, a design that takes into consideration everybody, not only those who are differently able. Why do you do that? Because when you do that, you don't have to make special arrangements or innovation or go into special costs for those who are differently able. What should universal design achieve? It should achieve that transport infrastructure provides accessibility for people who are differently able to get to where they want to go. And we're talking about physical difference, we're talking about sensory, and we're talking about cognitive disabilities or handicaps. Transport accessibility must also be safe. The roads must be safe, the crossings must be safe, getting into vehicles should be safe for people with a disability. If a situation is unsafe, it contributes to insecurity in the mind, but also in the body of those who are affected, and therefore diminishes well-being. Lastly, transport accessibility ensures affordability. So we're talking about access, we're talking about safety, and we're talking about affordability. If people are differently able, are forced to take special transport, to pay more, which they cannot afford, or pay more than others, this is exclusion, this is disadvantageous, and must be addressed. Lastly, let me say that examples of good systems, Hong Kong can come to mind, one can check on that. South Africa, Cape Town has a good system. Mexico City also. And in Kenya, where I live, I've just seen that there are some public transport operators who have arranged so that they go to homes of people who are differently able, pick them up, take them to their place of work or wherever they want to go, and take them back at no additional cost. I think this has to be emulated. Thank you very much for your attention.